HRT stands for hormone replacement therapy, and it's a term that we use to describe the treatment we provide for patients who are going through and experiencing the symptoms of menopause. Menopause occurs when the ovaries stop producing hormones. To describe that a little bit further, the ovaries are what contain a woman's eggs, and she's born with a specific number of eggs, and that's all the eggs she will ever have. The eggs are formed during the fetal period of life, and those eggs are all surrounded by a little nest of cells called follicle cells, and these are special cells that produce the hormones. So as a woman ages, these eggs are gradually depleted, and once the eggs are completely depleted, the follicle cells are completely depleted as well, and she stops producing hormones. Now, the age at which that happens varies and could be anywhere from early 40s to mid to late 50s for some patients. Of course, the definition of menopause is the final menstrual period. And if a patient is not having periods because she's had a hysterectomy or for possibly other reasons, then you couldn't use the final menstrual period to figure out when menopause occurred, but it is technically when those hormone levels drop. And it is the drop in those hormone levels which causes the symptoms of menopause. Now, I'm sure most people are familiar with what those symptoms are. Hot flashes and night sweats are the main symptoms that we think of when we think of menopause. Of course, vaginal dryness is a symptom that can begin to develop over time as well. And the severity of these symptoms and how long that these symptoms might last will vary greatly from patient to patient. So not all women who go through menopause actually use HRT. First of all, menopause is not a disease. It's a natural process of life. And we can think about the ovary as one of a group of specialized organs or glands in the body that produce hormones. Other examples would be the thyroid gland, the adrenal gland, the pancreas. And most of these glands are producing hormones which are essential to critical body functions. On the other hand, the ovary is a specific gland related to reproductive hormones, and reproduction is not an essential function for the health or life of the individual. It's important for the survival of the species, but not necessarily the survival of the individual. So when a woman goes through menopause, unlike when some of these other organs might fail for whatever reason, it's not a condition that must be treated. Some women breeze right through menopause and don't really need any HRT or any treatment, but if women are having significant symptoms, then HRT is the most effective way to treat those symptoms. Now, some women also have medical conditions and may not be able to take HRT or may choose other non-hormone therapies, and there are non-hormone medications as well as herbal remedies that can be particularly helpful sometimes for milder symptoms. I often get asked about the safety of HRT, and that's where some of the communication or misinformation has occurred over the past couple of decades. But we now have a great deal of knowledge and research on HRT that we can feel very comfortable saying that it is very safe, particularly for those individuals who are going through menopause and experiencing those symptoms. When we talk about HRT, which hormones are we talking about? Well, estrogen is the main hormone that treats the symptoms of menopause. Women who still have their uterus, however, also need progesterone, and this is really the only indication to add progesterone to HRT. And the reason about that is that estrogen, while it has all these favorable effects, it does have an effect on the lining of the uterus, which we call the endometrium, which is a stimulatory effect, so it causes the endometrium to proliferate. And if this goes checked over time, it can cause an increase in growth of the endometrium to the point where the endometrium may become precancerous or even cancerous. If we add progesterone, then that provides protection to the endometrium and balances out any adverse effects of the estrogen. Now, in some patients, we may add testosterone if they're experiencing specific problems, perhaps related to low libido or sexual desire and that sort of thing. The main component of the hormone replacement therapy, or HRT, would be the estrogen. Now, there are lots of different options in terms of the forms of the hormones that can be given, as well as the route of administration, or for instance, it can be given in a pill form, patch, topical gels, and there are also vaginal creams and tablets and things of that nature that can be specifically used for the vaginal dryness and those types of changes related to menopause. There may be an advantage of non-oral forms of hormones as it relates to reduction in a small risk of blood clots in the legs or the lungs related to HRT. Hormone levels are not usually needed to make the diagnosis of menopause. If a woman presents to the office in the appropriate age range with the typical symptoms, having the typical menstrual changes that we expect, then we can make that diagnosis clinically without checking any blood levels. Also, they're not usually needed to determine the correct dose. Our goal of therapy with HRT is usually that we want to try to help manage the symptoms of menopause at the lowest effective dose. That way, this helps to improve the safety of HRT because we're only using the amount that's really needed to treat the symptoms. So we're not really treating a specific blood level. The good news about HRT is that we have learned a great deal now through research about the safety of HRT, and we can feel good about prescribing it for women who really need that as they go through menopause. And I would encourage women to talk with their care providers about HRT and menopause and what they're going through. Board-certified ObGYNs are trained in the treatment of menopause, and the North American Menopause Society is a great resource. They have a website that can be helpful with information, and they can help with locating doctors who have gone through certification as menopause experts.